So do you want to tell me then what is the main role of the speech and language therapist for cdoc patients during this sort of, full-on rehabilitative phase?
So we admit them actually, and we don't call it rehabilitation. We admit them on a specific cdoc pathway because I think rehabilitation implies a change in function. So we actually admit them on an assessment pathway, assessment and management pathway. And I think that's probably what our role is as speech and language therapists, to get in and with the rest of the team, with the very low level patients, to assess for are there any behaviours that indicate awareness. So we'd be looking at the same things as, say, OTs and physios, lots of joint working, to look at sort of maybe pre-communicative behaviours, so looking at people, visual tracking, turning to sounds. They're all precursors of communication as well as awareness. And then perhaps with the slightly higher level patients, we get much more involved with, if they're MCS plus, showing some community behaviours, we might get really stuck in with, are they consistent? What can we do as speech therapists? How can we choose appropriate stimuli? How can we make it relevant and meaningful? And trying to develop any behaviours into a more robust communication system, if it's possible, based on their level of consciousness. So there's that real assessment. We also are quite key in supporting tracheostomy management and weaning, because we're looking at the dysphagia, and with many of these patients it's about saliva management and saliva swallows. So we're looking at maybe instrumental assessments like fees, to support the team with whether cuff deflation is appropriate or safe, or weighing up the risks and the benefits, or then whether we move forward with that. And with some patients, if their swallow will support it, we do some taste trials, we do dysphagia management, and it may or may not lead to eating or drinking, but we use it very much as a hopefully motivating context to look at awareness behaviours in a very functional task. So rather than just putting, say, taste on the tongue, we'll actually embed it in a hand-over-hand feeding task and seeing what the patient can actually do, responding to different tastes and looking at communication and awareness behaviours, but using swallowing as a tool to do that.